Brittany Harlow. I am here today with Lauren Jenkins, the CEO, president, everything of Native Oklahoma Insurance. I'm so happy to connect with you because I feel like we just have such a kindred story of pretty much how we had started out and the direction that we went in. And so for anyone not familiar with our news organization, we started 7 years ago as an organization to serve underrepresented communities, the communities that need it the most. And years of research and community service and working hand in hand with our community members, we constantly identified the greatest need was for Indigenous news coverage, Indigenous programming. And so that's primarily what we do, the most of what we do today. And so just learning about you and your story, and I'll let you tell it, but that's pretty much how it went with your insurance company. Is that right?
Yeah, essentially, I mean, I started out in health insurance back in 2013, and the ACA and Affordable Care Act was coming to fruition at that time. And naturally, looking at the plans and enrolling people and being in the heart of Indian Territory, we came across tribal members and were able to find the benefits that they get under these new laws, or the laws that were new at the time. And so naturally we started helping more of those people, realizing there was a huge need there, realizing that there was a great opportunity for these people to have, choices and choices in their healthcare too, and whether they want to use tribal providers or outside of the tribe, or having referrals issues or things like that they were able to overcome these challenges with those additional benefits for tribal members. So we help everybody with health insurance. So we're not just tribal members, but we are the leading specialist in the country, I would say, for tribal members being able to find coverage through these laws that were put in place.
And I'm so glad that we connected, because even myself, I've had so many questions, and I've had private insurance now for as long as I can remember, as often as I can afford it. But even getting married, my husband is Native American, our children are Native American, and so they are essentially, in a way, covered through the local, tribal hospitals and things. But I am not, except for when I was pregnant. So I have gone the traditional insurance route. And, one thing that I'm so busy, and I'm sure it happens to a lot of people, but I would constantly miss that healthcare deadline. And,
right.
I would be like, oh, when's the deadline? I need to make sure. And, oh, darn, you missed it. And I have an insurance broker that helps me with it. But just connecting with you and learning so much, and one of the biggest things that I've learned from you is that since I am part of a mixed Native American household, I don't have to wait for that deadline to get coverage for myself or my family. I can do it at any time, correct?
Right, yeah. Tribal members, I believe, are one of the only qualifications for being able to have a year-round special enrollment period to be able to enroll in this coverage. And not only does that extend to them, but it extends to their family members as well. So if you have family members that are not tribal members, then they can also sign up for a plan as well with you. And so we do that a lot. We'll help find coverage, not just for the tribal member, but the spouse or the children, if they don't have sooner care and things like that. So that way they can get coverage also. And their plans don't have the exact same benefits, but they do have benefits based on the household income. So you can get a lower price or lower deductibles and things like that based on your income. So, but for tribal members, of course, they get, everything, they get cost sharing paid 100%. So they have zero deductibles, zero maximum out of pocket, zero co-pays. As long as they're in network with the insurance company, everything's paid 100% if it would normally be covered.
Now, so is that dependent on income, or that's pretty much any tribal members get those benefits?
The initial qualification for those additional benefits is based on income. So it's basically for a family of four, I think it's about $94,000 a year right now. I don't have the exact number, but it's 300% of the federal poverty guidelines and below. And of course, if you qualify for Medicaid or Sooner Care, you would be on those programs. But if you don't qualify for those and you're between that Medicaid level and 300, then you can go ahead and qualify for this plan. There's some other things that come into play, like if you have employer insurance offered to you, or VA coverage, or Medicare. So we go over all of those with you, because there's, each household has so many factors that are just personal to you. And so it really takes someone coming in and going over those details with you and being able to say, okay, do you have this? Do you have that? What's your income going to be? What's your household size? And who has coverage? Who doesn't? And we sit down and provide a white glove treatment for everyone, basically, on what we would like to say was the easiest way to get health insurance and the most painless, really.
I'm curious for the level that you had mentioned between Sooner Care and that 300% of the federal poverty level for tribal members. Is that, would you say that's a good chunk of people in Oklahoma?
Yeah, it's a significant number of people. Most people do fall within those ranges. The majority of our clients do, of course, but it kind of depends on your situation. And some people may only have one household member working, or may have both, and they might be over those guidelines, but we can still go over, even if they do go over those guidelines, what are options, so that way you're not left without any choices. So we just want to lay it all out there for them. We are an independent insurance agency, so we don't work for a certain carrier or for a certain company. We represent ourselves and our clients. So we want to find what's the best option for you and just lay it all out there and let you, decide. And we carry, we provide, coverage for all the carriers that are in the state. So we don't, we'll be able to give you all of your options that way, and not, particular ones.
I'm wondering, when obviously talking about insurance, and in Oklahoma specifically for Native American people, that insured rate is pretty low. There's still a lot of people out there that have that need insurance, that could use insurance. And we've also talked about, there's some people that think that they don't need insurance because they are Native American, and that there's, there's tribal hospitals and clinics, or that maybe even that they go to a local hospital and they don't think that during a catastrophic event like we were talking about before we started filming. But what kind of cases or stories have you heard about people needing emergency care and thinking that they were covered, and then finding out that, it actually doesn't work that way?
Well, there's been a lot of cases that we've been told about, or that we know about through family or friends or clients, that they end up, they might just be relying on tribal providers for their care, which is perfectly fine. There's no issue with that at all. But then if there's an emergency situation or something comes up, or perhaps they thought that they were going to get approved for something, but then the funding was low, or they had to wait until the next year to do it. And so they kind of they've kind of gotten put on the back burner in some cases. And while the tribes do, I'm sure, everything that they can with the best of intentions, but they're also limited on what they can do. So this is kind of like a fallback for people that, especially if they live abroad and they don't live close to a tribal provider. That's another, thing. And we service all the surrounding areas as well. We service, Texas, Arkansas, Missouri, and Kansas, as well as Oklahoma. So anybody in this area, if they're moving across state lines, they can have those benefits of being a tribal member, but being able to travel with it. But there's cases where people will go to the emergency room and think that, well, they don't have anything, they just have tribal coverage at that point, or coverage through the tribe, and they will get a bill in the mail for that emergency room visit and say, well, it's not covered, you didn't have insurance, and then the tribe may or may not be able to approve that, or there wasn't a referral in place, and so they're stuck with that bill,
which could be upwards of 10, 20,000, like tens of thousands of dollars,
depending on what it was. It could easily be that, tens of thousands of dollars. And so having these plans does give you the flexibility of being able to use the tribe and those providers. If you want, you can still use the insurance at the tribe, and that helps the tribe too. Or you could go to outside of the tribe to the providers in the network for the insurance company. So you could use any of the major hospitals or doctors that are in that network. And there are lots of plans to choose from. So each one has a different network usually. Mm-hmm. So that's where we kind of come in and we, let them know, hey, what are your doctors? What are your prescriptions? What's your situation? And then that way we can try to specifically find a tailored plan for them, so that they're not just getting on some plan where it's not even in network where they want to go. But it does give tribal members extreme flexibility from being able to not have to go through the referral process at the tribe and not having to wait if needed. And they can go outside of that, and they're treated just like regular health insurance, where they don't, need that tribe, referral.
I'm really glad that you had brought up like that kind of insider knowledge, because I know that I had shared with you a while back basically about how just had this horrible experience for 6 months through getting a dental surgeon for my baby. Not a baby, but he's a little kid, and I love our providers that we do go to a tribal clinic, and I love them. They're so wonderful, and they gave us these options when they're like, okay, he needs to have a tooth pulled, he's going to start getting sick, we need to start this going, here's a list of people. And I was like, okay. And I'm very naive, very ignorant to a lot of IHS, a lot of the different tribal clinics beyond. And so I didn't know that list was of different tribes, different tribal, clinics and hospitals in the area. So I was like, oh, this one's close, I'm going to pick this one. My kids are Muskogee. I thought that, since I was, at a Muskogee-owned clinic initially, that's where I was going, but it wasn't. Yeah. And we ended up going to, through months long a process where we had, there was only one pediatric dental surgeon in the entire hospital, and it was for a lot of kids. And they had said that even though this tooth needs to go, we can only get him in 6 months. And I was like, that seems like a long time, but we'll just keep it going. Well, then he got an abscess and it got infected, and it was very scary knowing that he had an infection so close to his brain. And I'm reading all these things on the internet and I'm getting terrified. And, I just kept calling, and they're like, oh, well, we can give him some antibiotics. And I was like, well, surely this would put him at the top of the list. And unfortunately, there's just such a long waiting list at that hospital of a lot of kids who need surgery.
Right.
So I was like, well, what are my options? Because his surgery is still, now 3 months away, and it's going to probably get infected again. They're like, oh, well, you just need to keep giving him antibiotics until we can get him in for surgery. And I was just like, this doesn't seem right. And so I made a lot of phone calls. Again, it was many months of stress. And then finally I was like, well, no, you need to go to this other clinic. If you do go through, Muskogee Nation, then they could put in a referral for a non-tribal, dental surgeon. and you just need to go through the referral process. And thankfully they got us through that quickly. And so he was able to have surgery like a month later instead of 3 months, but it was still just such an eye-opening, stressful experience. And if I had someone with me that could have kind of explained those things or helped me navigate things, I feel like it wouldn't have been so traumatic. So the idea of like partnering with Native Oklahoma Insurance for our family's insurance needs is not necessarily just getting you coverage, but you have like insider knowledge of like navigating these systems for a long time.
Yeah, and we're kind of the liaison between the insurance carriers and the clients. So we're not just enrolling you in a plan and getting you off on a plan. We're also here when you need help. And so anytime you can call us, you can text, you can message us. And we, if things come up, if issues come up, or if you can't find your card, or if you need documentation of any sort, or if maybe the insurance is not showing active, or the pharmacy's having trouble, like we get all these calls all the time from our people, and we're just here to help you through the life of the policy. As long as you want the insurance and you have it, we're here to help you. And we don't charge anything for our services. You would pay the same price going out into the marketplace on your own and buying insurance on your own or using anyone else for it. They're all the same prices because it's all based on your income. So really, it's, a free service that we offer where it's not going to matter if you're using us or not. But we'll probably, hopefully, be able to find you even a better price than you will just because of our knowledge of the insurance companies and what networks they have. Some people will just go out and try to find the cheapest thing possible, which a lot of our clients qualify for zero plans anyway. But you think, I'm just going to go out there and just enroll in whatever's the least cost and get it to me. But a lot of people don't realize that there's a lot of nuances between the insurance carriers, and that may not be what works for you. Or you may want to go to a certain hospital or doctor, but then they're not in network. And, so there's a lot more to it than just the enrollment. And we're here to advise, and we've got tons of years. I think we have over 30 years experience together combined. And we have so many things that we found out over time of programs that the tribes offer, pharmaceutical assistance programs, things like that, that we also just have in our arsenal for help and for our clients. So it's not just even about the health insurance. It may be about other programs or other resources, which I love. That's why I love what you guys do too, is because you're creating a resource for people to be able to help themselves and to be able to get connected with stuff that benefits and programs that they may have access to but don't even realize it.
And it's interesting that you bring that up too, because you don't really think about how much you want a good specialist until you have a very bad specialist.
Yeah, that's true.
And that's kind of how another path that I had went on, seeing a specialist for something, and it was just a miserable experience. And I took it to Facebook, and people were like, oh, you should try this person is great, this is my specialist, you should definitely see them. And I was so excited. And then everyone that I, was brought to my attention was not in my network. And so I was like, oh man, I definitely need to change. And it also like that importance of being able to find out and kind of guide your insurance to, the hospital group or specialists that you want to see is also, even though there's so many people that would qualify for no cost insurance or low cost insurance, there are still a group of people who are above that 300% threshold, like our family, for instance. And I've been paying just for myself private insurance for a long time. And so, paying an additional a couple hundred a month for me isn't necessarily like a huge deal, because again, it does support the tribe, and it does, it takes the burden, off of the tribe a bit. And it also is, like we had also talked about, a real sense of security, because again, we may not necessarily, I love the idea of the 100% preventative care and being able to know that our family is covered that way. But I also, have young kids, and they're prone to breaking stuff and doing things, and really at any moment, it could be a catastrophic event. And then, you're stuck with that bill. And I think that when I was looking at the options, a lot of the out-of-pocket is $7,000 to $9,000 deductible. And it's like, oh, I need to find a lower deductible. But, we were also talking that it's not necessarily like the idea that you're going to hit that deductible, right?
Right. Yeah. So most people, insurance is one of those things that, as much as I hate to say it, you don't want to have to use it, but then you feel bad if you don't, because then you're like, oh, I'm paying money per month for something that I'm not even using. But the truth is, you really don't even want to have to use it, except for maybe preventative care and things like that. But at the end of the day, not using it is a good thing overall. But it is very much a situation of, if you may not be likely to use it or meet your deductible or meet your out-of-pocket maximum, but the moment that something like that would happen is the moment when it matters the most. Just kind of like with life insurance, you may not have it, and it may be fine until the moment you do need it. And then at that point, it's something that you would be like, oh man, I really wish I would have looked into that more, or
life-changing.
And it doesn't, even if it's not an exorbitant amount of money, even enough to cover funeral expenses or time off work when you're in mourning and things like that. It's just, there's a lot that goes on in those events that it's good to have this financial security. So even if you don't qualify for a $0 plan and you're looking at paying something per month, it's important to remember it's giving you that financial security in case if you do have a catastrophic event. But then in the meantime, you can also get preventative care or birth control or vaccinations or things like that, or doctor's visits, urgent care visits. And some of those things can actually help you from getting to a catastrophic point, where if you are using your insurance for at least those preventative measures and checkups, then at that point you can avoid potential issues later down the road too. So while you may not be using it for things besides preventative, that's still really important. And then you have that financial security as well in case if something big does happen.
Because I have, I would say like the biggest hospital bill I've ever got was $15,000, and it's just kind of, and I've seen much, much higher, and it's pretty wild to think that medical care costs so much when, especially if you through your job or whatever, you've had insurance, it's, you only see the what you owe part. Right. But for people who go to the hospital, and if it's their first time to an emergency room, or having, even situations where it's like, thank God it wasn't what we thought it was, but we ran all these tests to make sure, you still have to pay for those tests, whether or not your life was actually saved or not.
And the costs keep going up, year after year too, and the cost of pharmaceuticals and the cost of these tests and new technology and things like that, it really just ends up building on each other, and compounding over the years too. So things were expensive years ago, and they're even getting more expensive now. And so, but I think it's worth, like we were talking about earlier, the vast majority of the people that we talk to at least do fall within those guidelines to be able to get some sort of assistance. Even if you're above the 300%, you can still qualify for assistance. You just may not get those additional benefits as a tribal member, but it's worth looking at. It takes us maybe 10 minutes to get an idea of what you might qualify for, or, what, your family might get, or what are some options. And if you're in the best plan for you already, then we're going to say, hey, this is good where you're at. At least you can be rest assured that you looked and got someone to go out there and see, okay, where am I at right now? Am I actually paying a good price, or could I save money, or what's happening? And so we would be happy just to give people the reassurance and say, hey, let us just look at it for you. If you want to call us, it takes 10 minutes. You can call us in your pajamas at the convenience of your own time. And we're not going to hound you. We're not going to pressure you. We are literally here to help people and explain health insurance and the tribal benefits and how that can benefit you. But it's no pressure. If it's not for you, or if you're in a better situation, then we'll definitely let you know that. And then we'll be here for when your situation might change.
Awesome. Well, thank you so much, Lauren. You're going to be seeing a lot more of Native Oklahoma Insurance. They are our presenting sponsor for our new Returning to Balance series, which is going to be out soon. We're definitely going to put all the information in the comments as far as where to get a quote, what kind of information that you'll need, and then of course, relating to Returning to Balance, Native Oklahoma Insurance is also going to have a huge presence at our Indigenous Roots American Indian History Symposium that's coming up October 4th and 5th, because that is a big part of what we do is connecting people to resources, as Lauren said, that improve their lives. And that health is such a big part of that. So I'm just so grateful and blessed to have been connected with you. And I look forward to serving and working with our communities together. Is there any final thoughts that you wanted to throw out there?
Well, if you've seen us around or you see our billboards or our ads, I just recommend to go check out our Google reviews. We actually have over 1,000 now 5-star Google reviews, which I say is pretty good for health insurance world. But we're really proud of that, and we really love our clients, and we have a really close relationship, and a lot of them will go out there and really put this long review of everything they loved and the experience and the whole team. And I'm just so proud of those reviews, because you could tell that people really spent time leaving them, and it just goes to show, in a world where health insurance is such a negative part of people's lives, for the fact that we can turn around and have over 1,000 5-star reviews on Google it's just a testament to what we are doing for the community and how we are helping people. We're also A+ accredited on the Better Business Bureau. So we've got a lot behind us. So even if you're like, oh, I don't know about that, or I want to check it out, just go online and check out our Google reviews, check out our website. We've got a lot of information there, and you can just fill out the form on our website or give us a call anytime. And, we're here to help and serve the community.
Awesome.
Thank you.
Thank you so much, Lauren.
Thank you.
And again, keep an eye out. We'll be sharing a lot more about Native Oklahoma Insurance soon. And thank you so much for watching. If you have questions, make sure to drop them in the comments, and we'll get them to Lauren, and she can get you taken care of.
Thank you.